Who doesn't want to see a recording of Rob?
Yeah.
It's okay. So I really want to just thank everybody so much for being here. As we all know, 4CT has been doing incredible things. And if any of you guys are lucky enough to know Robert, he is just one of those guys who's just like a joy to be around, so positive. One of the things I miss about COVID is like, seeing people like Robert around town, but he did like disappear to South Africa for a little bit, but he's back. So I'll tell you a little bit about him. He runs the 4CT program at 4CT and is a founder of Social Venture Partners. So none of us would be here without the fact that he started it with Don. In addition to his volunteer work through 4CT and SVP, Robert worked for a year at the Connecticut Institute for Refugees and Immigrants as the Job Development Coordinator in the Refugee Department at CIRI. He has been a board member at CIRI since 2014. Concurrent with his work in the nonprofit sector, Robert obtained a master's in teaching from Sacred Heart University and taught financial literacy courses at Stratford High School. Prior to his retirement from the for-profit business world, Robert spent 25 years working on Wall Street and in the global commodities business in a variety of roles, including finance, operations, risk management, trading, business development, and IT. He has a BA in finance and an MBA, both at UConn. He lives in Fairfield with his amazing wife, who is truly amazing, and 3 kids. He's an avid sailor, post-Commodore of Black Rock Yacht Club, hence his shirt, runner, crazy fit, and a world traveler. So welcome, Robert. So happy to see you again, and so happy to have you lead this discussion for us.
Thanks for the intro.
Sure.
A little over the top, but that's okay.
That's right. You deserve it.
But I really appreciate it. And for those of you who I know, I see some of your faces. Great to see you. For those of you who don't, I want to thank you for being part of SVP, because it's near and dear to my heart. And you'll see that I believe that there are a lot of good things that 4CT and SVP will be doing together in the future, based on discussions I've had, Mark and others. So 4CT, you can go to 4ct.org if you want to know more, but it was started by Don Kendall and Ted Yang, 2 other of the co-founders of SVP. Back in March of last year as a response to the pandemic. And the goal for that was to provide a conduit for private philanthropic dollars to help in the relief of the pandemic. They recognize right away that state and federal governments can only do so much and it can only act so quickly, and knew that philanthropy wanted to help, but didn't have a really clear way to do that on a statewide basis. We're all familiar with the county-based foundations. If you know United Way, you know that there's Connecticut United Way, but there's also 15 other United Ways within the state. And most of the nonprofits we're working with are very chopped up, either in a neighborhood, in a city, single city, or maybe a few cities. But from the beginning, 4CT will only work on projects that are at least 50% of the state in coverage, as far as individuals, because we feel it's time that we start to be a little bit more cohesive in what we do. And we believe from statistics that it is the largest private, or geographically largest private organization or philanthropic organization in the state. So with that being said, I want to kind of divide it up quickly. I'll go over some of the stuff that we did to begin with, right? So our first, and you'll notice a lot of similarities between the way that SVP operates and the way that 4CT operates, for obvious reasons, right? Volunteerism. SVP was all 4CT was all volunteers to start with. We've since hired on a few people, but we've had probably about 70 people cycle through and volunteer their time with 4CT, which made us highly efficient. We collected about $14-15 million in grant money and pushed it right out the door for nothing, all within a very short period of time as a rapid response. If you will, let me see. So I'm just gonna, this is a one pager that we prepared. I'll go through quickly some of the projects that we worked on. Right, so our initial projects were, the idea was we went out and solicited organizations and said, hey, how can you, if you've got an idea and how you can help the people of Connecticut with what you're doing, please come and let us know. Send us a one paragraph. This is what the idea is. And then we worked with them to try to craft a final product of what a project would be. Unlike normal granting where, you kind of have that 12-page RFP, you send it out, people send it in, and it's like a job application. You either get it or you don't. We took a much more cooperative approach, letting our partners out who came to us with the projects, introduce them to us so that we could work on that. Some of the ones, in healthcare, we worked with, supplying PPE. We worked with all the federally qualified health centers across the state. Food insecurity, we worked with the two, of course, Connecticut's got two major food banks, right? Connecticut Food Share and Food Bank. They are merging, thank goodness. So we're going to have one federally supported food organization. Housing, again, working with the homeless partners or partners working in the homelessness area to try to keep individuals who are safe during COVID. Technology, that was a big one, where we helped buy Chromebooks for all these students, low-income students that were all of a sudden asked to be at home and didn't have the resources that typically you would find in the suburban parts of the state. Financial literacy, this was a big one. I'll speak to the VITA tax program. I don't know if those of you who know VITA, free tax preparation for low-income individuals, all face-to-face prior to COVID. We helped them roll out a virtual platform so that, and if you remember back in the day, you could not qualify for CARES Act without filing a tax return. So that was a huge impact, on what we did. I think we spent $150,000 and it yielded about $4 million worth of aid for the clients that had gone through our programs. And then our last and most notorious one was the 4CT card, right? So the 4CT card was, born out of our own ideas. As we looked across the landscape of Connecticut, we said, who is not being helped? And the undocumented came right to the surface, right? There is very little data about the undocumented population within the state of Connecticut. Somewhere in the neighborhood of 150 to 180,000 individuals are undocumented. That is also including people who are married to undocumented individuals, because under the first CARES Act, even if you were a US citizen, but you were married to an undocumented person, you were not eligible for aid. Obviously, the second CARES Act under a little bit more friendly administration, that is not the case. I worked with Emily Lamont, the governor's daughter, and we surveyed the United States to find out how are the undocumented being helped. And the programs that came to the surface were New York City, state of California, city of Los Angeles. So we spent a lot of time on the phone listening to how they rolled out programs, how they ran programs. And it was very clear that if you just provide people money, they will provide for themselves, right? You don't need to make it more complicated than that. And so we ran with the idea and we got in touch. We nuanced it a little bit for a pandemic and for Connecticut. Most of the time they were doing the work themselves. What we did instead was partner with community-based organizations all across the state who were already working with the undocumented population. And we asked them, based on very simple criteria of a client has to live in Connecticut, they have to have been affected by COVID, and they have to be either undocumented themselves or married to an undocumented person. And that's it. And we let them identify those individuals. The part of the problem at the beginning of the pandemic was that those community-based organizations weren't really working, right? Nobody was in the office. So we came up with an idea that kind of killed two birds with one stone, which is we worked with the federally qualified health centers. So 19 of those across the state. So once an individual was assigned a card by one of the community-based organizations that knew that individual system really well, or status really well, they were asked to go to the nearest federally qualified health center to where they live and pick up the card. So the reason we did that is one, the health centers were operating and the health centers had COVID protocol in order to make appointments and have people show up safely and be dispersed properly. But the second thing is that the undocumented are typically very unfamiliar with the healthcare that is available to them, even if they are undocumented. They can get free healthcare at any of the federally qualified health centers and their ICE-free zones. So at the time that they went and picked up their cards, our partner organizations at the health centers also informed them about COVID testing, eventual COVID vaccination, but also just complete family healthcare. And you'll see some of the statistics I'll show you later how that turned out. That program, the way we designed it was quite unique. We won a national grant to defer the cost of the actual cards, $2 a card, and defer the cost of the back office administration, which we farmed out to United Way of Central and Northeastern Connecticut. We were part of a group of 10 programs nationwide that received this grant from Accelerator from America, which was a pass-through grant from the Open Society Foundation of George Soros fame. And I have to say that we got calls from all other 9 asking us how we did it and how we did it so quickly. So I'm really proud of the work that our team did in putting that together. I will segue now. Let me see if I'm going to. So this gives you some ideas. Not only did we, once we worked with the undocumented community, we also worked, we had a grant come in where someone said, hey, I'd love to help essential workers who kept working during the pandemic and therefore putting their lives and their families' lives in danger. So we worked with a separate group of partners, communities of faith across the state, to identify those essential workers, and the grant specified that they would get a stipend 3 months in a row as a, I don't know, thank you, but help support them. And we allowed our partners to select who those individuals were based on very basic criteria. And then lastly, the state came to us. They have a quarantine and isolation program where they asked, or they were helping low-income individuals quarantine and isolate when they had been exposed to COVID, not only helping them, but also with medical and other needs, but also helping the rest of the state slow down the rampant growth that we were seeing towards the end of last year in the kind of October, November timeframe. And they came to us and said, how can we help? And we said, look, we've got this card program, very simple. We can give these debit cards to the caseworkers so that they can buy incidentals for the people that are being asked to stay home. And we can also provide cards to the individuals themselves to help them defray the costs. Because when you're working at minimum wage or on an hourly basis and somebody says, hey, you got to stay home for the next 10 days, it's not so easy. And so we helped the state do that. So what we proved in doing those 3 programs is that it is real, and each one of these took us, undocumented took a little bit longer to first, because that was our first go round. The other 2 took less than a month to set up and run because we just replicated the model over and over again. And what that proved to us is that we could be extremely rapid in this. And it also helped us with our kind of decision-making process that, direct financial aid, the more we looked into it, and the more we looked into working with our partners, and building trust with our partners and building trust with the actual recipients of the card, the better it was for everybody. And it was fast. People got what they needed, not a lot of red tape, and everybody qualified based on whatever our criteria was. Our partners loved us because our undocumented form took 3 minutes to fill out. We timed it. And we had an advisory committee that helped us set up that form, set up the other aspects of the program so that we did not offend or scare any of the individuals in our programs by asking silly questions. When's the last time you filled out a form that didn't ask for your name and address? If you don't need name and address because you're not sending anybody a Christmas card, you don't need to ask for name and address, right? And so, because especially with the undocumented community, if you ask for that information, they will not show up. So we were very careful at the beginning to, did not pay any of our partners to administer this program, because we said, look, we're enabling you to help your clients, and we're asking you for 3 minutes of your time to fill this form out. We did not pay the health centers because the health centers, it's part of their role is to engage with the community. And they agreed with that. It's not like we had to force or twist any arms to do that, or we wouldn't have grown our community. But we listened, very importantly, to our partners, every aspect of the program, to our advisory board, and created a great feedback loop to continuously improve our process for not only our partners, but also the end recipients. So where are we going now? So we've reconstituted our board at 4CT. And I will, hold on, maybe I can put this into presentation mode, a little easier to see. And in reconstituting our board, we have a new focus that we are not working with projects that are presented to us anymore, right? The sole purpose of 4CT, or the sole aim of 4CT, is to provide direct financial assistance to people who need it. And like I said, trusting our partners to help us identify those individuals, and trusting those individuals to be able to manage for themselves. And you'll see kind of in our future plans why that's really important for us to continually emphasize that. Our first population that we targeted in 2021 was the ALICE population. I don't know if you are familiar with ALICE or not. ALICE is an acronym that stands for Asset Limited, Income Constrained, and Employed. So these are the working poor. So these are people that are above the federal poverty limit, but are just scraping by because the federal poverty limit is not very realistic, especially in a state like ours. So our program is targeting the lower half, the ALICE population. We are targeting those people who are facing some sort of an emergency, like a housing emergency, a food emergency, utility emergency, medical emergency, who have already tried other means of helping get that emergency solved, whether they be federal programs, state programs, private programs, whatever it is, and are just and don't qualify for them for whatever the reason may be. Again, we are finding that people, if you make an extra $50 a month and you don't qualify for a federal program, you get nothing, right? So we're trying to fill that gap by distributing these debit cards. We're using our same partners that we had in the first go around, which was about 20 organizations. We are adding to that. So probably in another month or two, we'll be at 30 organizations statewide. We're using the same network of health centers to distribute the cards. Again, now people are going there and they're getting assistance again with medical care, but also with COVID vaccinations, things like that are important, not only for them, but for the rest of the state in order to get the hard to reach population with that. The program's off to a great start. We have allocated a couple of $1 million to that program, and we'll run that through the rest of the year. Again, working with our partners. The second target audience that we're working with are small and minority-owned businesses. That program started about a month ago, or the concept started about a month ago. We reached out to a different set of partners who specialize in working with small and minority-owned businesses, and asked them again to identify businesses where we could make a stipend to them, and that it would help them survive the pandemic until they could reopen again, by buying things like PPE, increasing their IT abilities to do takeout, helping staff stay employed. Those kind of things. Again, these are organizations that wouldn't necessarily qualify for the first round of PPP funding from the federal government. Obviously, under the current CARES Act, I think it's been passed by now. That may change, And so what we are doing is we put the program on hold after our initial set of investments of about 30 different businesses, again, across the state, and are waiting to see what the federal government is going to do. The objective of 4CT is to not step in front of any existing funding sources out there, right? We don't want to replace the government funding. We're never going to be able to do that with our capacity. The idea is that we run as a gap filling organization to help where other people don't get help. And then the last program, which we are just now formulating and hopefully will kick off in another month or so, is a student living support program. A student living support is, if you look at the latest college statistics within the state of Connecticut, and actually it's reflected nationwide as well, four-year universities are down maybe 1-2%. Usually that's because people have decided, hey, I don't want to learn remotely. I'm just going to stay home or skip this year or whatever it may be. Community colleges are down about 15%, right? So that is not a question of I just want to learn remotely. That's a question of the target, the students that go there, and it's mostly part-time students that have been affected negatively. Their jobs have been disrupted, their income streams have been disrupted, their support services, daycare, transportation, all of that has been disrupted, right? So they've had, where they had barriers before and surpassed those by going to school part-time, the pandemic has thrown up a whole new set of barriers that they're not able to get over. So we are going to be working with the community college system, and I don't know if any of you are working with SVP in that endeavor, but we're working with the heads of the community colleges to determine what is the best way to roll this program out. How can we give these students support beyond tuition, because that's usually free, beyond books, because even that is usually covered, but for other life expenses, such as daycare, transportation, whatever the case may be, food insecurity. Although, sad to say, sad but happy, most of the community colleges have food pantries now because they realize that their students, can't learn if they are hungry. So that's that. Again, we are not. You'll notice a pattern here in all of these. We are helping to identify maybe the target population that we're trying to help, but we don't do this alone. We have a very thin organization. 4CT right now, I think, has, I don't know, 7 people working for it. We don't envision going above 10 anytime soon, because we rely on our partner network to help us not only formulate the proper strategies in order to carry out these programs, but also then to carry them out themselves. And this just gives you some idea of our our programs, right? So we're looking to for this year, this gives you our budget, right? So a couple $1 million towards student support, $2.5 million towards Alice. These are all just estimates. We'll have to see. And then we're finishing off the undocumented, and both these are closed now, the undocumented program and the quarantine and isolation initiative. That's an event which you guys are all invited to. I'll make sure that whoever's on this call is going to start getting emails from 4CT. Because while we have had, our funding sources are all private, which is a question that comes up often. Therefore, we're not constrained by any federal regulations with regard to who we can give that money to. There is some regulation around, gift taxing, and that because we're in the middle of a pandemic, some of those have been waived. But if you give more, I mean, those of you who have given gifts, you're familiar with the fact that if you give over $600 to somebody, it can be considered a gift. And then you have to start getting 1099s from people, declaring it income. So it is not an easy, they don't make it easy. The federal rules around this, where you're just trying to help people. But we've, again, because we're in a pandemic, we've got an accounting support write-off on the fact that we can operate slightly differently during a pandemic. We don't know what it means going forward, and which is a good. Let me show you. This is a data dashboard that we built for the program. It was a real-time dashboard, so as the program operated, this automatically updated every 15 minutes. So we did not ask for supplemental reporting from any of our partners. All they had to do was do what they do, fill out the form, record when cards were picked up, that kind of stuff, and we were able to capture all that and automatically funnel it into a report. So you can see this is just the undocumented program. We built a similar dashboard for our other programs. Number of cards issued. These are the different geographic locations. We were a little disappointed in Middlesex. We need to just find some stronger partners there. But it's a good way for us to say, okay, yeah, we need to find stronger partners when you can do this kind of geographic isolation. As you can see, we covered 90 zip codes. Out of all the zip codes in the state, there's 169 towns. Each town has at least one zip code. So while it seems to be a big number, Connecticut is chopped up again into little pieces. You will see that our 20 CBOs that worked in this program and our 19 health centers helped us converge this. This just gives you an idea of, we started on June 17th in our first week, and we were done, kind of by the end of the week, or by week 26, in dispersing this much money. The other things we learned hold on a second. We learned some statistics about our programs. Again, this is all based on questions that we have on the intake. Majority Spanish speaking, which I think would be pretty obvious. But you can see, English was actually a preferred language for a lot of people. And then there's a huge Polish population up in New Britain. These were all undocumented Poles, right? So they're not, people say undocumented, you usually think of somebody from Latin America, but they come in all different ethnic backgrounds. Impact of COVID. One of the things that we differentiated is that the size of a family, right? So we considered family not a legal unit, but an economic unit. So if there was an adult and 2 children, and those 2 children depended on those adults, and that adult, that would be a family of 3, regardless of what their actual legal relationship is. What we found, and you'll see over here, families per household, this number here of 2 grew over time. So as the pandemic got worse, more and more economic units moved in together, and this number shrunk and this number grew, right? And we can tell that just by doing these date range, right? I can slide the date range around and all of these statistics will change. So I can see how our program changed over time. And then this is that silly rule that I was telling you about, right? So about 18% of our card recipients lived in a mixed household, meaning that one of the spouses was undocumented. And therefore, even the US citizen could not get any assistance under the first CARES Act. And then, so those just give some demographic. And then there's the part of the report that says, okay, so what kind of impact did you do? What kind of impact did you have? Right. And this shows you, because we were using debit cards, and I'll explain, the debit cards are simple MasterCard debit cards. You can use them anywhere, just like you would any debit card. They do not get loaded until they're actually in the hands of the individuals. That's a safety thing, not only for the program, but also for the individuals. We asked them going in, where do you think you will spend the money? We were a little shocked that 84% would spend money on food, because we thought to ourselves, well, why the heck are they spending money on food when we have all these food pantries that are operating? We found through our partners' advice and our advisory board, they said that undocumented people tend to shy away from food pantries because, guess what? When you go to a food pantry, what do they ask you for? Your name and address, right? And if you're undocumented, you're not going to go to someplace that asks you for name and address. Furthermore, some of the local food pantries aren't multilingual. So to the extent that you needed to make an appointment to show up to get food, you couldn't do it if they didn't speak your language. So one of these 2 facts we brought up to the Commissioner of the Department of Agriculture, who we were working with in the food bank project as 4CT, and just let them know. We said, look, you know what, and with the food banks as well, if there's any way that you can instruct the local pantries to stop asking for this information, unless you really need it, don't ask for it, because you're missing an entire part of the population that's using financial aid to buy food as opposed to support themselves other ways. We were able, because of these debit cards, our all spending is recorded at a store level basis, right? They're called MCC codes. We can tell at a store level what people are buying, down to the individual. You can see that one thing that was important that our advisory board told us is when you're working with the undocumented individuals, you need to make sure that they have access to cash. So our cards can be converted into cash at an ATM machine or Stop and Shop or whatever for a very small fee, because the undocumented live in a very informal economic community, right? They don't go sign a 1-year lease on a rental property. They typically don't sign anything, or may not have anything other than a promise to pay and a handshake. May go week to week, and maybe the landlord is undocumented, so he doesn't file, he's not eligible for any kind of assistance either, and they pay him in cash. So it was very important, and we listened, and we made sure that the cards can be converted into cash. But you can see that food was a big purchase here, right? General merchandise. So the cards were restricted, right? If your store was listed as a store that sells alcohol, tobacco, firearms, principally gambling or lottery, then you could not use the card there. But those were the only restrictions. And with those restrictions, we saw the use that people would be suspicious of, but what we would all do if we needed to feed our family, which is to go and buy things that we need to support ourselves during the pandemic. Healthcare question, we asked them on the way in, where do you get your healthcare now? This is great, 60% already were going to health centers. The problem is you got 13% going to emergency, you got another 13 going to urgent care, and you got none of the above. So this is a big problem, not only for these individuals, but it's a big problem for the state of Connecticut because it's extremely economically inefficient to have this happen. So once they went and picked up their card, again, this is not a longitudinal study, but we asked the recipients, do you think you will come back here to have further healthcare discussions and to maybe make this your home? Again, you got 48% say, yeah, they're already a patient, but 20% had a different medical home. So it could be that they're going to another a doctor's office or something like that, but at least they've got a medical home. The encouraging part was that 17% who didn't have a medical home said they were going to come back because they're likely to return. And even the unsures, right? If you even got half of the unsures, you've all of a sudden converted 22% of the people who had no medical home into a place that will use a medical home that, again, is not only beneficial for them, but beneficial for the entire state. And this was just a side effect of our program, right? It has nothing to do with the money. This is the money part. This is the healthcare part. So I'm going to stop there before I just talk about 4CT's future, just to see if there's any questions about what we've done so far. I don't see, everybody's on mute.
Rob, I have a question.
Sure.
So you have a budget, obviously, for this year in terms of these three focus areas that you talked about. Could you talk a little bit more expansively about what you see as kind of the potential future for the 4CT card and its initiative? Yeah,
so that's the next set. So if nobody has any questions about what 4CT's done so far, with regard and kind of our intermediate goal of becoming just direct financial assistance, I'll move on to kind of a future slide. Although it's not really a slide, but so in the news recently, if you've been watching NPR or listening to NPR, you've heard the former mayor of Stockton, California, come out and talk about an experiment where they gave people cash stipends, $500 a month, no questions asked, and they did it with 125 individuals. This and they did it. It was income based, right? So you had to qualify for this program based on income, and that's called required basic income, right? So that you've got universal basic income, which if you've followed the news, you understand universal basic income. Everybody gets a level payment regardless of what your income is. If you look at required basic income, there's actually some income constraints in there. So they experimented with these 125 people, and they found that by just giving them cash with almost zero overhead on the administration of that, other than just following these individuals, they improve their own lives without anybody else's help, right? They were able to become more stable in their jobs. They were able to increase their level of education. There's some statistics out there, and again, you can go and look these up. These I just snagged off the income or the internet. So what 4CT and there's Stockton, California is one of 12 cities that is participating in these programs where they're running these experiments. And if you look across each one of these, and some of them are mid experiment, some have a little bit more data. It's being done internationally as well. What people are starting to figure out is if we waste a lot of time in trying to tell people what kind of help they need and how that help can happen, right? And it's funny, I had a discussion yesterday with somebody, and I'm thinking about even SVP and the role of SVP is to kind of help strengthen the best of the nonprofits, which is great. But there's some incredible inefficiencies out there. If you think about $100 of your tax money goes to the federal government, which then takes part of that money and subsidizes a farmer to overgrow food so that it can be put back on trucks, brought back to Connecticut, and then distributed through this massive network of food banks and local food pantries, so that somebody at the end finally gets some food that they didn't ask for, they're just handed it, which may or may not be culturally or dietetically appropriate for them. We have a funny story, funny and sad at the same time. A member of the 4CT board grew up food insecure and remembers quite well having a 4-pound block of cheese sitting on his counter for a month, right? Because you just can't eat that much cheese, but that's what was available and that's what was handed to them. So that $100 in tax money that you go up, that gets through the whole system, probably, may end up in $1 worth of maybe, questionably appropriate food for an individual. Whereas if you just gave them $100, they would go to the local bodega, or they would go to Stop and Shop, or wherever they'd go, and they would spend the money locally and they would get the food that's appropriate to them. So that's just an example of why 4CT in a kind of long-term basis is heading in the direction of giving people cash, right? Let them help themselves. There's a lot of skeptics out there. We had, again, another comment on our board that, when you are rich, people trust you a lot, right? So if you look like me, and I go to a BMW dealership and say, hey, I'm interested in this car, they hand me the keys and off I go, no questions asked, right? Poor people don't get trusted, right? As if it's their fault that they are poor. And so what we are trying to do is take that stigma away. Not everybody's going to believe in this, right? The naysayers will say, hey, you know what? How do we know they're not going to spend it on X, Y, and Z? Well, that's what these other experiments have tried, right? What happens to these people? And again, it's a small trial. It's 125 people. They are selected, based on various criteria in each one of the 12 cities where this is being experimented with. But it does show that people, that this is a valid method in order to support people. It flies in the face of all the kind of things that we've all grown up with, saying, oh no, we need lots and lots and lots of nonprofits to help everybody out. Each one's segmented in a little area of what a person's help may be, but it doesn't put a lot of trust in those individuals. So that is something where we are headed. We're not going to be there in 2021. We will examine that towards the end of 2021 as we kind of come up with a strategic plan for 2022 and what we want to do. Do we want to run this kind of experiment as an adjunct to some of the other direct financial assistance that we do? Do we, that's going to take some, again, you need board members that believe in it. You need employees that believe in direct financial assistance, and you need funders that believe in direct financial assistance. But you will see that more and more people, are starting to trust clients, right? I was on a call or a presentation this morning with Grameen Bank, who most of you are probably familiar with. Grameen Bank US was summarizing what they did this year and how they helped people by making micro loans to women, which started in Bangladesh, and now it's a multi-million-dollar bank in the United States. They've got a 99% payback rate on their loans. And I don't know, I mean, Everett, I see you there. I'm sure you would be really happy if you had a 99% payback rate on your loans, but back in the day when you were at Paribas, right? So it's an amazing thing, but that again is based on trust, right? It is not based on, them sending a goon squad to get these loans. People, you have to start trusting these people. So there is momentum behind the funding side of things. There's momentum behind the research side of things. And we hope to be kind of the go-to for direct financial assistance for the state of Connecticut. Whether that's a universal basic income, required basic income, or just like the direct financial assistance programs we're running now. By being the state of Connecticut, we can attract not only local, meaning in the state of Connecticut dollars, but we hope to also tap into national dollars, because really no one cares about helping one town in Connecticut or one organization in one town in Connecticut. I mean, just outside of Connecticut, they do in that town, and they may on a regional basis, the county basis. But if you go to a national funder and say, hey, I'd like to help somebody out in Norwalk, I mean, I don't think they're really going to pay attention to you, right? But if you say, hey, we've got 3.5 million people living in the state of Connecticut, huge disparity in income, and a big racial mix, racial disparities, or not disparities, big racial mix-up. This is a great place to run these kind of things. So we're hoping to attract some of those national dollars to us. And that's it. That's my, been talking now for 45 minutes. So I am open to take questions, suggestions, donations, whatever it may take. Oh, and again, back to the link with 4CT and SVP, right? So SVP is by its nature, and Mark, tell me if I'm wrong, but by its nature, it is doing things differently than has been traditionally done, right? We're constantly looking for new and better ways to do stuff, or helping organizations look at new and better ways to do stuff, to become more efficient, right? Every nonprofit should be in business to put themselves out of business. And I see SVP and its huge partner network and 4CT doing the same thing. So when we say, hey, we'd like to target community college students, the first thing I do is I call up Mark and I say, Mark, who's the community college partner or organization that I should speak with to get this thing going? So I think that kind of linkage between two very forward-thinking and active organizations that are statewide focus for the most part, I think is a great match, and I look forward to doing a lot more work going forward.
I've got a question, Robert.
Mm-hmm.
What I was struck by the graph where it said in Fairfield County, so many more people took advantage of this program than in other counties. I know Juanita's on the board. Like, why is it because of the relationship with FCCF, and that, or why? What made that so successful versus other counties?
I think there's probably more undocumented individuals within Fairfield County than there are anywhere else, right? As much as we'd like to think that they don't live here, they do, and provide a tremendous amount of service for us. But I also think it depends on your partners, right? I mean, Middlesex also has a big, Middlesex County, where Middletown is, also has a big population of undocumented individuals. But we did not have a very strong partner there who, a lot of times we'd go into a town. I mean, you'd be amazed how hard it is to go into Hartford and say, hey, we'd like to work with undocumented individuals. Right? We were looking under the rug and everything, trying to find organizations that worked with them. One organization, Catholic Charities, we came up with them. They said, great, we're on board, we'll help out. 2 weeks into the program, they said, okay, we're done. And I'm like, 2 weeks? How could that be? Right? And they had, I don't know, maybe identified 40 or 50 individuals. And we said, no, that can't be. So it's, again, I think the population lends itself to, there's no like big giant area or organization that works with them. But it also speaks to the fact that it's really difficult to find 20 organizations in the state of Connecticut that will work with you and that believe in a program. We connected them all, right? We had every 2 weeks, we had a phone call between all the 20 20 community-based organizations or all the health centers, so we could refine the program. They could learn from each other. We had a situation where a woman that lived in Hartford had to flee Hartford because of domestic violence. And so the Hartford community-based organization called us up and said, hey, she went over to, I believe it was New Haven. What can I, what do I do? And I said, all right, call the New Haven community-based organization that's part of our partnership, and you two speak to each other, and the two caseworkers can work out how to get this woman help. And so they did. So I think us building a coalition and continually maintaining that coalition by listening to them, by bringing them in, by getting them excited about projects, we hope to make this really an active coalition. And we've all heard the word and shuddered when we hear that word, because nothing ever goes on at coalitions. So our partners frequently speak to each other, and we encourage them to, outside of our, they don't have to go through us to do that.
I think Everett's.
Hey, Robert.
Hey.
Is there anything, well, first of all, congratulations. It's a fantastic story, and your presentation was terrific. It's really great what you're doing. I was wondering if there's anybody at the state, if you've inspired the state to reform its own approach to its welfare programs, or how they distribute monies and things like that. Is there anything, are people at senior levels of administration in the state saying, hey, maybe there is a better way? I just didn't know if the state, how the state.
Yeah, I mean, we were in constant contact, and still are, with the state government, up to the governor, up to and including the governor, with everything that we're doing. And we field phone calls from them all the time, helping them. The governor and his administration wants to help people, but their hands are tied, especially under the last administration, with things that they could do. We've got personal statements from the governor on our website. He personally, he's a big, a fan, if you get what I mean. And we have not accepted any state or federal dollars. However, we're just a tool, and if the governor decides, or the government decides, hey, we're going to try some of this, it's easy enough for us to use our tool and use those dollars. Now, anytime, it's like doing a deal with the devil. Anytime you take federal or state funding, all of a sudden your hands are tied and your documentation, quadruples. So we'd like to stay private. Certainly, I think the first efforts at required basic income are going to be private. I don't see the government stepping up anytime soon. But fortunately, there's a lot of heavy hitters out there with billions that are thinking, hey, this is a good idea. So really, it's just a matter of us getting in touch with those people and pitching to them that Connecticut is a perfect place to run this experiment. We've also got thought partners that we can team up with. University of Connecticut, Yale, all of them I think would jump on this in a second to help do kind of longitudinal studies. Again, that's not something 4CT is built to do. We're a funding conduit and maybe an idea generator for these programs, and a coalescer of partners to get it done. But it's certainly something that we're heading for. So yes, there's huge support at the governor's office. I would assume that things are going well, that he would get reelected. So I think there's long-term support for this type of stuff. So we're optimistic about that.
Okay.
It has gotten a lot of press in the past couple of weeks.
Yeah, no, I mean, and it takes a fundamental change in the way you're thinking. I was not brought up this way. I liken it to, those of you who are out stock picking every single day, thinking you're going to beat the market. That we all grew up like that. And now we're thinking, you know what? It's almost impossible to beat the market, right? So you spend all this time and energy and all the rest of stuff. And, are you really doing it? Or should you just go the easy way and just play the market, just put your money in there. So again, I know that's kind of a weird way to think about it, but this is that same thing. I mean, think of all the hours and manpower involved in administrating various and assorted programs to help people, and to find out what they, what they need and all the rest of the stuff that could be avoided if you just said, hey, take care of yourself, like most of them want to. And there will be fraud, right? I mean, we don't We did not design our systems to prevent fraud first and then give aid second, right? I am fully aware, and when I show you that chart of where that money's been spent, I am sure that there are people that have figured out ways to convert it into cash and go right to the liquor store and buy them bottles of whatever. Is it the majority of the $1.5 million? No, it's not even close. And what they found even when they gave those people the $500 stipends per month, that less than 1% was spent on kind of sins, if you will, when they asked, when they were able to specifically track what people did with the money. So, I'd take 99% efficiency any day, because there is not a nonprofit out there that runs at 99% efficiency that actually shows a result that these 125 did of, they work more, they educate themselves more, their kids, their health outcomes are better, for the sake of $500 a month. That's pretty good.
Hi, Robert. This is Lana from Women's Mentoring Network.
Hi.
We were the recipient of of a funding for computer and digital literacy from 4CT, and we're ever so grateful for that. It was a most successful program. In terms of the next phase, if you aren't a partner now, would I look to a United Way to see if I could partner with them? Because we have received funding actually from the United Way that goes directly to our clients. So I'm not sure, for my clients, again, we're in Lower Fairfield County, and we're not a partner now, but I'm just curious about that. And then what type of tracking are you looking for going forward with this, the new program, the 2.0?
Well, so United Way, along with other organizations, I know Person to Person and Darien.
Robert, you're
They all have their own financial assistance programs that
Robert,
they find very
you need
different.
to back up like 15 seconds because you blocked out. And you are right now too.
Difficult to, am I frozen? Funds that they use for emergency fund for a living, like 4CT does. Right. So I think to answer your question, United Way will have their own program. You can certainly go to United Way. That's fine. They're not our program, right? United Way of Central Northeastern Connecticut. All they do is our back office administration. So it's that our programs aren't tied. For us, when we sign up a new partner, what we look for is does that new partner bring to the program a set of people that were not being reached already, right? So, either because it's a new geographic region or it's a new set of audience, like you've got some sort of specialty that you bring people in that other people don't see, right? So we brought in Siri in Bridgeport because they work with refugees and immigrants that maybe aren't being helped in other areas. So it's really so if you wanted to jump in and say, okay, yeah, look, here's our organization, here's our target audience, does that fill a gap in the people you're trying to reach? If so, then you sign up. I send you a 2-page grant agreement that the lawyers make you sign, and that's it. There's no follow-up, right? So you would get a link, you'd fill out a form, your client would go to a health center, pick up the card, and that's it. There's no audit afterwards. There's no, people have asked us, say, well, do you verify income? Do you, if you say it's a housing emergency, do you need to copy their lease? Do you need, no, and our answer is no, because you can do, as a partner organization, you already have your own protocols on how to vet people. We're not going to tell you how to do that because we don't know, right? That's why we have partners. So whatever vetting protocols you have and whatever documentation requirements that you already have, that's fine with us.
Okay, I just want to be cognizant of the time. It looks like we have one more minute. Is there any other questions before Robert signs off here? No.
So I will, so on that shameless marketing, I'll throw this up. So Ted is involved in a Highclere Castle gin. Highclere Castle, for those of you who know, is the castle where Downton Abbey was filmed.
You're muted.
So he and the current owners, Nervan, developed a gin. It's actually quite good. I have some sitting on my liquor cabinet. And the first lady, Governor Lamont's wife, Annie, are all going to be in this kind of fun gin event. I'll make sure everybody on this list gets one. You get into the event, the recommended donation's $1,000. You get a gift basket with that. Not that everybody's doing it for a gift basket, but it's kind of fun. And if you like gin, we'll send that to you. That's kind of our next event. By the way, we don't do these events often. This is going to be, I would say, event-based, whether we do a trivia night or something like that, or maybe I'm going to guess it's 5% of our income. The other 95%, we're looking for big foundations and private donations in big amounts, because again, we've only got a few people and we can't spend all of our time doing this. We'd rather run the programs. So, but this is a fun event. If you guys are interested in it, I'll make sure you're on the email list for everybody gets this invitation.
Robert, I just wanted to congratulate you and the 4CT team for your amazing work on this. This is really kind of made such a difference for so many people in our state, and the innovation and just effectiveness that you've had in terms of going from kind of idea to execution is just really inspiring us all. So
yeah,
keep up the great work.
Yeah, no, I mean, look, it's all you need to do is read some of the testimonials that we receive from our clients, and we've got thousands. And you realize why you're doing this, right? It's amazing. The small, you may think $300 card, what can that do? But when it allowed a woman to go back and forth to get prenatal care so she could have a child, it's amazing.
Yeah.
Fabulous.
Thank you so much, Robert.
Thanks.
So
And if anybody has follow-up questions, I got a new official email, Jess, robert@4-ct.org. You can just ping me. Happy to have private conversations with anybody about anything you saw, any questions you have, suggestions. We're always listening. So if you've got ideas, if you've got articles you want to send me, please do reach out. Okay.
Marjorie, do you want to just mention the upcoming kind of event next week on education?
Sure. Jamila Prince Stewart, and let me just get the exact details if you want to tell me.
And Lisa Hammersley, I think.
Yes, and it is on Wednesday, this coming Wednesday from 10:30 to 12.
And they're going to be sharing they're going to be providing information on the educational equity bill that Faith Acts and some other organizations are leading. This will be kind of an informational session. So it's an hour and a half. They'll go through all of it, have plenty of time to answer questions on it. And this is really to try to get more educational funding for school districts that are lower income, have a lot of English language learners, and people of color. So next Wednesday.
Wednesday at 10:30. And everybody will get an email about that. All right, I want to close it out so we're not keeping people. Thank you so very much for being here, Robert. Thank you. So great to see you. Can't wait to see you in person.
Well, thanks to all of you partners at SVP. Keep doing what you're doing, because again, I think all of us are in this together to kind of do things differently and change things up and make things better for our state. So I really appreciate all of your time for what you do.
All right. All right.
Thanks.
Bye, guys. Thank you.
Bye.
Thank you.
Bye.